This is a presentation of patient dental biofilm from the sulcus. So we see on the microscope low power 100 magnification, female patient of about 50 years old with many crowns, and she comes back from a Caribbean area, tropical area. So this is at 1000 magnification. See here we can clearly see Entamoeba gingivalis, the amoeba in the center, surrounded by many neutrophil white cell. Here again, red cell on top, and we see a little line on the amoeba that probably phagocytized this some of those red cells. Again, another amoeba with the pseudopod. We can see a little bit of the nucleus, and many features inside the amoeba are part of nucleus ingested from the white cell. Here again, two amoeba, Entamoeba gingivalis. On the lower and top right are many ghost cells. So those are remnant of neutrophil that has lost their nucleus to the parasites. Here again, one amoeba, two amoeba, three. So many of them are very present during the periodontal active disease. So this is why we think microscope is very useful to explain to the patient, and also to complete this diagnostic of parasitosis during periodontal disease. So most active periodontal disease are infection of bacteria, but most present is this amoeba, Entamoeba gingivalis again. So here again, 1, 2 amoeba. We clearly can see the little nucleus, 4 micron, some ghost cell, again an amoeba, always surrounded by white cell. Here a little more of those bacteria, bacilla, that reminds us of Fusobacterium, orange complex, and some Vibrio, and also some spirochete. Reminding us of Treponema denticola, which is part of the red complex. So we see some bacteria, but most present is see this enormous amoeba with the nucleus, karyosome in the center, and chromatin on the surrounding of the nucleus. Here we see the amoeba who has ingested a lot of material. Most of this ingested material is red cell, phagocytose of the red cell, and phagocytose of the nucleus of the neutrophil. Here again, it's pretty infected. This is what we can call clearly dysbiosis in periodontal disease. So this is dysbiosis and inflammation, uncontrolled inflammation. So we have to get rid of those bacteria, get rid of those parasites, get rid of those amoeba to cure the condition. Here again, many bacilla, and in the center, amoeba, Entamoeba gingivalis with pseudopod. Oh, here we see one Trichomonas. So this is Trichomonas tenax with 4 flagella on the lower side. We see again remnant of neutrophil, white blood cell, many spirochetes, many bacilla around them. Here again, organized bacilla around some form of actinomyces stricture. And again, bacilla, spirochetes, white cell. And again, we can find 1 or 2 big amoeba, Entamoeba gingivalis with pseudopods. It's full of material they have eaten. Here again, enormous amoeba during periodontal disease. So it is important for the doctor, for the practitioner, for the dentist, for the periodontist, to make sure to get rid of this dysbiotic material, get rid of the inflammation. So what we can do is apply the Bonner method, apply the periodontal healing protocol, get rid of all this dysbiotic and inflammation material within the active periodontal sulcus. Here again, always the same, pretty much infection, amoeba, white cell, the bacilla very present, red complex, and parasite are omnipresent. So let's use the microscope to do our diagnostic. Let's use the microscope to do normal treatment, get rid of those parasites, get rid of those bacillus, parakeets, and get rid of this inflammation. When all this is gone, you have green complex only, cocci and filament, and then your patient can be cured. Of course, you have to remove calculus, but first remove the infection, remove the parasite, remove the red complex, orange complex, to make sure patient gets better. Thank you for listening.